Well, it's difficult to go last. I guess the the stem winders have already been delivered, and the call to arms having been made, left with a few things to say. First, of course, is that really the honor and the gain in the organization has been Donna Smith's work for CNA. It is our gain to have her on board, as you all know. Also, I bring greetings from the executive director, Roseanne DeMauro, who was born and raised in St. Louis. And that's right, I gotta play the local card. For some reason, she moved to California. I don't know why. And then, that's right. So it's pretty interesting though, because I would venture to say that we are the only group of healthcare activists anywhere, healthcare reform activists, anywhere in the country who are meeting, who are not celebrating this bill. 3,000 people in Austin today demonstrated at the state capitol celebrating and promoting this bill.
Those are people who didn't know
And
anything about that bill.
they may not know anything about that bill, that's right. But it is quite, I mean, it's a sobering fact. It is a sobering fact. And so we've learned some things. We've learned that legislators are not movement leaders. We've learned that legislators will sacrifice their core principles if they think that's what it takes to pass a bill that they think is worthwhile. Right? That and maybe we knew that already, but we've learned it again. We've also learned that we were actually in a war with the White House for the last year. We met a year ago. We set up the Leadership Conference for Guaranteed Healthcare about a year ago in D.C. And we were pretty excited about Obama's election. And we thought, oh yeah, sure, he's not for single payer, but we can convince him. Or we can we can demand a policy debate on the merits and get it. We can rely upon our progressive allies in Congress. And we know that the president will certainly have us at the table. And instead, they excluded us. They fought us every step of the way. They didn't want this healthcare reform bill to be tainted by government-run moniker, right? They didn't want it to be described as a government-run healthcare bill, so they had to do everything they could to distance themselves from the single-payer movement. And that became clear as we really engaged in this fight. And so we were essentially in an undeclared war with the White House for the last year. And what happened to them is that they lost the debate on government-run healthcare. They lost that debate because they weren't willing to wage it. And instead, the right wing became the defenders of Medicare. Just think about that for a minute. The right wing became defenders of Medicare. So it's not, which is actually not to say that I disagree with Quentin Young. I was involved in the Clinton era healthcare fight, and people said that we were, that single payer was taken off. Single payer was taken off the table in a way that kind of would make your head swim. For those of you who remember that, but. Then there was this notion that for 15 years nothing happened. But instead, of course, 15 years we continued to build a movement. We continued to fight in the states. And we continued actually to make single payer an issue that the White House and the powers that be wanted to go away. And we didn't let it go away. And that is perhaps the most important lesson for this last year. What I think the other lesson we've learned, is that we are a movement with many tactics, but with one objective. And that objective, of course, is that universal, nonprofit, publicly financed health care that provides a single standard of quality care for all. And that's single payer. And that objective is what will continue to be at the forefront of our movement as a moral imperative, as healthcare is a human right. It is a moral imperative that we're engaged in here, ultimately. And that will continue to animate us. But as we do that, there are many tactics. Tim talked about this. These tactics do not need to be presented as an either or. We don't have to say that one is direct action and one isn't. It is direct action to produce educational materials and engage with folks in forums, in educational forums. It's direct action to lobby these elected officials. They may not be principled, but they still have a vote. And we need to demand that vote. Of course, civil disobedience is a direct action. And we've got to make sure that our civil disobedience puts forward our message, right? And our mass demonstrations are, of course, a direct action. And those are crucial. So all of it is essential. And one of the most important aspects, I think, of this weekend is that we recognize the value and the power of those different tactics. And not get in some false debate about what's more effective, who's more important, or which tactic has to be the only one that we use. I think we can have a very productive strategic discussion to understand how we can integrate those tactics and that become our strategy for the coming period. As a nurses organization, we're going to continue this fight, as I said, because essentially there is no other solution to the patient care crisis. We're building a new national nurses union. We already include from Pennsylvania to Maine to California to Nevada, Arizona, Chicago. And now we're going to join with other nurses organizations across the country and have 155,000 RNs in a union committed to single payer. And that will be something. And we have moved the labor movement an extraordinary distance from where they want it to be. Remember, we were told, well, if you talk about single payer, you will not be allowed a seat at the table. So the labor movement can't talk about single payer. Well, we proved them wrong. And at the end, toward the end of this fight, as Jerry said, the AFL-CIO affirmed its historic support for single payer. And that has a hell of a lot to do with the work of Kay and Walter Tillow and the union activists who built that campaign. The patient care crisis reverberates in the cuts to public health across this country. They're trying to close 2 hospitals in Cook County, where we represent the RNs. They've closed hospitals, as folks have talked about here, throughout the country. And that is unacceptable to us, and this movement for healthcare justice will endure because we will take on those fights. And we will take on those fights in a way that says there is a solution that goes beyond what the insurance companies and the pharmaceutical companies, the powers that be, the corporate execs who want to divert monies away from people's needs. It goes beyond all that, and it goes to the essential fight that every nurse on every unit does every day, and that's to ensure that patients get the health care they need, not simply the health care they can afford. That's why we're here, that's why we'll continue to be here, and that's why we will ultimately win this fight for guaranteed health care.